guys, so today I'm going to show you a short 4 exercise sequence for the low back for any kind of pain or issues in the SI joint, hips, low back. This can really cover a lot of major issues. And the primary muscle that we're going to be working on activating more is the glute medius. So glute medius is this muscle right in here, and it can tend to get weak and kind of stop doing its job, which means that we're putting way too much load into, the hamstrings. Glute major, piriformis starts overdoing its job, and we can end up with an imbalance in the hips or weakness in the SI joints, lots of different issues. So the first thing we're going to start with is coming right down to your yoga mat and getting into a bridge position. So just your standard bridge, lifting up, squeeze, hold, and down slow. Now this one I'm just doing as a little bit of a warm-up to activate the lower body, the pelvic floor, and the whole region of the glutes, low back, and core. So let's do this 10 times, coming down slow and pushing away with a little bit more force and speed. And then this is our last one. Up, squeeze, hold, down slow. Just go ahead and bring the alternate knee into the chest and extend the other leg out and reverse, just so that we're not working with totally cold muscles here. All right, now we're gonna come back to bridge position. We're gonna lift up, and then we're just gonna step the heels out and in, out and in. Now this might look really simple, but it's actually activating a lot of micro muscles, and it'll get you warmed up inside. So the key point here is to keep your hips high and try to keep them level no matter which foot is no longer supporting your hip versus the other. And that's where we really start to increase the strength of our stabilizing muscles and help to support the surrounding muscles around the SI joint. Now I'm going to come down nice and slow and bring both knees into the chest. Kind of rock it out a little bit. That got my heart rate up a little bit. I hope that you're feeling it too. Now we're going to come up to standing, and if you have, get a kitchen stool or something of similar height. We don't want to do anything really high because then our knee is going to be too bent. This is about the highest that I would want it to be. You could also just do this on a stair step if you have one at home. So we're just going to stand up on the step and bring the opposite knee up. Now the reason for this is that when we bring this opposite knee up and lock this leg out, we're really activating this high point of the glute. And that's the area that tends to get a little bypassed in typical physical training, and we just don't always put a lot of attention to strengthening this muscle. So we're going to come in and do this 10 times, and we're going slow on the way down and a little bit more speed and force on the way up. And shaky is okay. You can probably hear in my voice I'm a little shaky on the way down. That just means new muscle fibers are growing, new neural pathways. It's a good sign. All right, so now we're gonna come over to the other side. Do the same thing, other leg. Up, squeeze, hold, and down. And if you fall out of it, no problem. Just come back to it, start again. I'm at 4 here. And you might notice when doing these separately like this that one leg has a lot harder of a time than the other, or there's more pain on one side than the other. That's okay. But what we're doing is we're helping to isolate the legs so that they stop relying on the other one to do all the work if they're a little bit weak. All right, last one. I kind of lost count. All right, there we go. So our next one is going to be for the psoas specifically, and you can use the same stool, or if bending down to this level requires that you ground your back, then get something a little bit higher up so you can maintain that flat back position. And then we're just going to raise the leg up and down, up and down, up and down. And this is to activate the psoas and to start asking those tiny micro tendons and ligaments around the SI joint to activate also. So we're just going to do this 10 on each side. So go ahead and switch legs. And same thing, you might notice that you can lift one side a lot higher and easier than the other side. And 3 more. 2 and 1. All right, I'm gonna come down into a squat in the middle of this one to just kind of let the low back decompress. I'm working through my own low back injury, so I'm learning a lot, but also I'm listening a lot more than I maybe used to and should have. So always listen to your body. If something doesn't feel quite right, find something that does feel quite right. All right, so now my back feels good and ready to go again. And I'm gonna use this same height level of support for this one also. So this is another one to activate glute medius. So we're gonna bring the one leg out behind us like a T, and then we're just going to rotate the hips so that we're stacking them on top of each other and bring them down. Rotate open and bring it down. Rotate open, bring it down. 4, 5, and I'm just gonna do 8 on this one because it's a little bit more intense. 6, 7. If you're burning too much, just stop. Maybe next time you do this, you'll be able to get one more. All right, kind of pedal it out. I feel that in my standing leg for sure. So now we're gonna switch sides, other leg up and back, and then rotate the hips open and close. Open, close. And you might also find that there's tension in the inner thigh that's restricting this movement. But being in this position and asking for this movement alone will help to open up those inner thigh muscles. And one more here. Okay, nice. Both sides are burning. I feel them activated. We did the thing. Oops. So then our last one is just going to be something to kind of stretch that out. And we're just going to come back down to the floor into your figure 4. And then you can bring your opposite knee into the chest. And you can kind of rock in and out of this if that feels better than just statically holding it. And if you are rocking in and out of it, make sure you're contracting when you're pushing away. So I'm actually actively pushing my leg away and then drawing it in. Pushing it away and then drawing it in. And when I say pushing it away, I'm pushing my ankle into my other knee away. And then just hold. Feels really nice. And then go ahead and switch over to the other opposite ankle on knee. And bring it in. Push away. And I use the push away because that helps to disengage the muscles where they are bound together in a tight aspect. So my left side is my problem child. And definitely a lot more tight, but also more painful. So when I'm pushing away, it's helping to disengage all of those tight muscle fibers from each other, because I'm asking them to disengage in a shortened position. All right, just kind of bring that knee more into the chest. You can let the other opposite foot rest on the floor now. Get that nice deep stretch, piriformis. And then we're going to come into windshield wipers. So bring your feet a little bit wider than hips distance apart here, and then we're just going to drop the knees off to one side and the other. Getting a nice rotation here. And after you've done a few rotating sequences, go ahead and bring your both knees off to the right hand side, and you're going to bring the outside of the right ankle on top of the outside of the left knee. So you're kind of creating a little bit more traction and pressure for that knee to draw away from the hip point. And if you want to increase the stretch in the front of this hip here, contract that glute. And so as you contract the glute and push the hip point forward, we're getting more of a stretch into the attachments of the quads, a little bit of psoas, iliacus, and in general, it just feels amazing, especially if you do a lot of work seated, or you drive a lot, or you just find yourself on the couch a lot. It can really feel nice to just open up the front of the hip points. So switching over to the other side, so knees off to the left, and the outside of the left ankle is now on the outside of the right knee. We're just gonna let it stretch. Feeling super groovy here. And then if you want that increased stretch, then contract the right glute and think like you're pushing the right hip point kind of to the corner, upper corner of the room. All right, bring it back in. Give those knees a nice extra big hug. And when you're ready, roll up. And that is your sequence. So I hope that is short, simple, and sweet, but also super effective for you guys. Thanks for participating. Bye.